We're going to see the pathogenesis of cystic fibrosis. Cystic fibrosis is caused by a deletion in the CFRT enzyme or protein, that is a channel that codifies for the channel that reabsorbs chloride in the sweat glands and secretes chloride in the gastrointestinal tract and in the lungs. This is a deletion in the 508 amino acids, that is phenylalanine for this protein. First, the normal, when we have the normal CFRT protein, this chloride channel, in the sweat gland cell, there is reabsorption of the chloride that leads to a absorption of a sodium. So we are absorbing a negative electrolyte and a positive electrolyte. In the normal epithelial cell of the lung or the gastrointestinal tract, there is secretion of a chloride and secretion of a sodium. And the water will follow the sodium. So here, water secretion. If there is mutation in this CFRT protein, there will be deletion of these amino acids, then the protein will be misfolded. It will be degraded in the protostome, but so there will be no CFRT protein here in the surface of the cell, so there will be no reabsorption of the chloride. So here's the same cell. There is no reabsorption of the chloride, so the natrium will stay here in the sweat gland duct and in the epithelial cell of the gastrointestinal tract or the lungs, because there is no secretion of chloride. Here is a lot of chloride inside the cell, and so a lot of sodium inside the cell. The water will not follow the sodium and chloride that usually be here. The water will enter the cell, and so there will be dehydration of the mucus here. So this is a very dehydrated mucus, and this can cause obstruction of the gastrointestinal tract, like the pancreatic duct, and it leads to pancreatitis, or of the lungs in the bronchioles, and the patient will have pneumonia. So here the patient has infection, and here the patient has a sweaty sweat, a salty sweat, and this is part of the diagnosis. The complications is first the pneumonia. The most common microorganisms are Staphylococcus aureus, Pseudomonas, and maybe Burgdorfteria cepacia.